Hi, good morning, Michelle.
Good morning.
Are you ready to pass your meds?
Yes, I am. So I already checked the MAR and I also did an initial assessment of the patient, and I'll be administering insulin and acetaminophen this morning.
That's great, Michelle. Now tell me, what are some of the things that you should assess for the patient before administering acetaminophen?
So for acetaminophen, it's used mainly for his pain level as PRN, and since the patient acceptable tolerance level is a 4, he's at a 6 right now, so we should go ahead and administer the drug. And in addition to that, I also checked his liver enzymes, his BUN and creatinine levels, and it all indicates good kidney and liver functions because they are within normal range. And also, he hasn't taken any Tylenol within the last 4 hours, and he hasn't exceeded 4 grams today, so it's also safe.
That's right. Now can you tell me more about the insulin we're going to give?
So today we'll be giving regular insulin, and that's just to help control the patient's blood glucose levels. So I got a reading, and he's 175 right now, and so according to the sliding scale, we'll be giving 10 units today. I've also checked the patient's level of consciousness for any signs of hypoglycemia. There were none, and also no signs of nausea and vomiting as well.
Now, Michelle, do you think you're forgetting anything?
Yes, by the way, the patient also finished all of his breakfast, which is also very good.
That's great. It sounds like you're ready to go to the med room. Do you want to go?
Yes, let's go.
Okay, let's go to the med room. All right, Michelle, do you have your MAR with you?
Yes, I do.
Okay, so what are we going to do first?
So before we do anything, I'm going to get a basin, and I'm going to make a label for the patient.
All right, so what are we going to write on this label?
So I'm just going to be writing her first and last name, MR number, or date of birth, just as long as there's 2 identifiers on there.
All right, now pick out your medications.
Okay, so the first one that I'm going to pick out is acetaminophen. So I'm going to look for it on the med cart. And there's no acetaminophen, so I'm going to take out my phone, which is okay because we're in the med room, and I'm going to go on Nursing Central to see maybe if acetaminophen has another name. So acetaminophen does. It has another name, and it's called Tylenol. So I'm going to look to see if Tylenol is on here, and it is. So I'm going to pull it open. I'm going to grab a drug, and this is Tylenol and Tylenol. I'm going to do my second check over here. And basically, I'm just going to compare the name with the MAR to check if the dose is correct. So it says 325 milligrams on the MAR, and also says 325 here. And the expiration date is March 2021, and today is February 2020. So it's not expired. The bag hasn't been open, and it's fine and safe to use. So I'm going to grab a cup, put it in there. Okay, so for the third check, I'm just going to make sure that this drawer says Tylenol, and it's acetaminophen, and it matches the medication I got from there, and it does, so I can push it back in. And also I can do another check at the patient's bedside before I administer the medication as well.
Very good. Whenever we obtain medications from the med cart, we always want to compare it with the MAR. This is to make sure that we are giving the right medication to the right patient, the right dose, the right time, and the right route, and the right reason. Okay, let's move on to the next medication.
Okay, sounds good. So the next medication will be regular insulin. So for that, I'll need a syringe and the medication. So first, I'm going to be looking for insulin syringe, and here it is. So I'm going to grab one. This one here, and then I'm going to grab insulin as well. So this is insulin. So this is regular insulin, and it's for U100, which matches the label on the package for the syringe. So U100 insulin only, and expires in 2022, and today is February 2020, so it has not expired. And this as well has not expired. This is 2030, and today is 2020. So we can use this. Okay, and I'm going to swab it for 30 seconds. Okay, now 30 seconds has passed. I can put this away. So now I'm just going to be drying it out of the container. So I'm going to first check to make sure that this is the correct syringe. So it does say that it's insulin syringe, and it's for U100, and this is U100, and also that the expiration date is 2022, and today is 2020. So it hasn't expired. The package is dry and intact. So I'm going to go ahead and I'm going to open this. So I'm going to be putting in 10 units of air since the blood sugar for the patient was 175 this morning. So I'm just going to draw out 10 units of air first. Okay, I'm going to open this. Put it in. And then I'm going to push in the 10 units first. I'm going to draw out 10 now. Okay, so now that I've drawn up 10 units of insulin, since I'm just a student, I would have to have 2 licensed registered nurses come and make sure that this is correct. So can you please check?
Yeah.
Okay, blood sugar was 175, which is 10 units.
This is also 10 units, and the syringe is U100. Now for the second check, licensed registered nurse Jenny,
Yes?
could you be the second check for this insulin, please?
Sure. Can I see the EMR?
Right here.
Okay, so blood sugar is 175 and 10 units. 10 units, U100, U100. Looks good.
Thank you.
Thank you.
Okay, looks good.
Perfect, thank you so much. So now that you've verified, I can remove this off, and I can do a one-handed recap. Okay. So now that we have this, I can take a piece of tape. And I'm just going to put regular insulin on here. It's going to be 10 units, like so. I can make a little flag for this. And I can put it in the basin now. Okay, so I'm going to place insulin in now. So this is insulin, and insulin as well. And the insulin syringe as well. You can close that as well.
All right, it looks like you're ready to see your patient. Let's gel out and administer these medications.
Oh, how'd that go? It went great. So the patient tolerated the doses very well, and I'm just gonna go document that.
Now, after you document, what time should we check back on the patient?
Well, for acetaminophen, it's gonna take about 30 to 60 minutes since it was an oral, and I'll be able to come back to check his pain levels to see if it has gone down or not. And for regular insulin, I'm gonna be back periodically to make sure and trend his blood sugars to make sure there's no signs of hypoglycemia throughout the day.
Fantastic work!
Thank you so much for being such a wonderful primary nurse today.
You're welcome.